Assessing the lower limb veins is a quick and easy test that you can perform when you're questioning the presence of a deep venous thrombosis, or DVT for short. In this video, we'll walk through how to do it. I'm Dr. Alex Estelle, and this is SonoCare. Blood clots can occur in any part of the body, and the ones we're most concerned with are those that form in the deep venous system, as they can cause significant congestion from impaired drainage of blood, as well as pose a risk of pulmonary embolism. Of these, the vast majority occur in the lower extremities, with less than 10% occurring in the upper limbs. POCUS assessment of the upper extremity has not been well studied or validated, so we won't be getting into it in this video. Ultrasound is the imaging method of choice for assessment of DVT, given its ease of use, speed, and cost. This has made DVT studies a natural addition to the POCUS provider's toolkit. Radiology guidelines recommend a complete assessment of the deep venous system from the inguinal ligament all the way down to the ankle, including Doppler of the common femoral and popliteal veins. While this represents a gold standard, it takes some time, so more focused protocols have been developed. In experienced hands, a POCUS assessment of the lower extremity has a sensitivity of 95% and a specificity of 96% compared to formal radiology studies. So, with experience and training, we can be fairly confident that we can rely upon our exams. As always, and I can never stress this enough, clinical context always trumps the pictures we produce. Even the best tests and operators will miss things, so if your clinical suspicion for DVT is high and you can't find one, you need to think about whether you should get a radiology performed study, repeat the test in a couple of days, and whether you should treat the patient empirically until those results return. To perform this exam, you'll need to have your patient supine. In those who can, it's helpful to have them in a frog-leg position to better visualize the femoral and popliteal vessels. You'll use a linear probe in a transverse plane throughout, with the depth set to keep the vessels 2/3 of the way down your screen. Let's have a look at the anatomy of the deep venous system so we can learn how to perform an exam. The most focused scanning protocols use a 2-point assessment looking at the vessels in the groin and the back of the knee. To start, place the probe just under the inguinal ligament and find the common femoral vein, with a femoral artery lateral to it. Then compress the vein until it's completely collapsed. With complete collapse, we're happy there's no clot, and we move 1 to 2 centimeters distal along the vessel and press again. We need to make sure we identify the takeoff of the greater saphenous vein and the deep femoral vein before we can move on to the popliteal vein. Here, we pick up the most proximal part of the popliteal fossa, where the femoral vein becomes the popliteal vein, and again compress our way along the popliteal vein until it trifurcates into the anterior tibial vein, posterior tibial vein, and peroneal vein. I advocate for using an extended compression ultrasound protocol that includes a full assessment of the femoral vein all the way down the leg to the popliteal fossa, as an estimated 5 to 7% of DVTs occur there. To do this, simply continue past the deep femoral vein takeoff, following the femoral vein down the leg until it becomes the popliteal vein. While this can be a little tricky in patients with larger legs, increasing the sensitivity of the test is worth the extra effort. As I mentioned, we're looking for complete collapse of the vein with each compression. Acute clots may appear hyperechoic and are usually visible. Subacute clots are often hypoechoic and can be very difficult to see, so incomplete compression may be the only sign that we see that there's a clot present. Color Doppler can be helpful here too, as we can see blood flowing around the clot. Now we know how to perform a DVT study, it's important for us to be mindful of common mimics of DVTs. Muscle bands may appear alongside the vessels as rounded, well-circumscribed structures. Lymph nodes can sometimes take on the appearance of clots, but are themselves discrete structures. They often have a hyperechoic center and a hypoechoic periphery. The most important thing is to assess for continuity with the venous system when scanning up and down the leg. Performing a DVT study is a helpful tool for the acute care provider to quickly assess the lower extremities for the presence of blood clots. By using a 2-point exam, or better yet, an extended compression protocol, we can be confident that our exam can confirm or exclude the presence of a DVT, helping speed time to diagnosis and treatment. I hope you found this video helpful. Now get out there and scan.